But there is a role for coaches, and there is a role for bodywork specialists as well, what we call a bodywork double or a bodywork specialist. In Jamaica, we don't have those.
So sometimes when we, for example, when we see these movies on television where you see someone who's labeled a sex therapist,
Yeah.
but they're actually involved in a sense of watching persons having sex and then instructing them
Yes.
as to positions and
Yes.
and how to maximize
Yes.
these things. Could they be possibly they're coaches who are
I would say
graduated to
they're
becoming a sex
coaching.
therapist?
I would say they're coaching. They may well be sex therapists because they've gone and qualified as a therapist, but that is not therapy. That very clearly is not therapy. Therapy is talk therapy. It's not physical activity. So they may well have two labels that they're carrying. They may well be a qualified sex therapist, but actually what they're doing, they're a sex coach. That's not what therapists do generally.
What should the client expect of the therapist?
The client should expect the therapist to be respectful, honest, deliver sufficient tools to handle the problems that they're having, and to be actively listening to what they're saying so that they can provide them with the right kinds of inquiries. Because what we're really doing is asking you the questions that you need to ask yourself so that you can gain some kind of insight. If you leave therapy without learning anything more about yourself, it's not been very effective. You should learn something more about yourself.
The issue of confidentiality.
That is very important. It's a basic rule of all therapy. Therapists, priests, medical doctors follow the same code of ethics. We are not allowed to discuss what we speak to a client about with anyone else. If I'm doing couples therapy and I have, let's say, a man and a woman, a heterosexual couple, and I speak to one partner and they disclose something to me, I'm not allowed to say it to the second partner. I absolutely have no right to disclose anything a client says to me.
Yeah. By the way, speaking of heterosexual couples, would you treat same-sex couples?
Absolutely. Same-sex couples, heterosexual couples, intersex couples, and also quads, triads, etc. Not everyone is in a couple.
Okay.
There are people in multiple relationships.
We're going to come back after this break to continue our chat with sex therapist Dr. Karen Carpenter here on Michael Anthony Cuff Live. Thank you for staying with us here at Michael Anthony Cuff Live. If you're just joining us, my guest is Dr. Karen Carpenter, sexologist. We're talking about the role of the sex therapist, trying to unpack, trying to understand some of what he or she does in that particular role. Karen, just before we took the break, I was asking you about what can the client expect of the therapist. But
Sure.
let's flip the question on its head. What are there expectations on the part of the therapist where the client is concerned?
Absolutely. If the client is coming in alone, then we want to know that the client is motivated to do something about the problem that they've come to us with. And we call that the presenting problem or the presenting complaint. The client comes in, they say, I'm having difficulty with, let's say it's early ejaculation. I'm having difficulty ejaculating early when I'm having intercourse with my partner. I think I'm, ejaculating too quickly, and I'd like to be able to please my partner. We expect as therapists that this person is serious about treatment, is serious about assisting themselves, and is motivated to change that behavior. And therefore, when we do say, okay, well, I'm suggesting that your homework for this week is A, B, or C, and we allow a 2-week period for them to do that homework, we expect that the next time we have therapy, you've done the homework. It's like a series of stepping stones across a river. If you don't do the homework, we have to start back on the same stone that we were on the last time. And it's not useful to you.
Before the client comes to you as the sex therapist, are there other considerations that have to be ruled out before?
Absolutely.
And
Absolutely.
what are they?
Yeah. Usually my clients come to me by referral. I don't usually see people from the street unless they're coming to our free clinic at the University Hospital, and then they've called in and made an appointment with our research assistant. The clients who come to me privately have been referred by a gynecologist, urologist, medical doctor, psychiatrist, or psychologist who doesn't deal with sex. So these are my referring colleagues, and they will already have checked out whether or not there's a medical issue, whether or not there's what we call a comorbid condition,
Which is what?
which means that whether or not this person has some other condition, perhaps a pathology, schizophrenia, bipolar, personality disorder of some sort, if there's anything else going on. And I will get a letter of referral telling me whether or not this person is on medication, what dosage, and what the previous diagnosis was. That helps me to move forward with the client.
Okay, so now that the client has come to you
Yes.
and they have presented, where do you begin?
Well, I talk to the client in my intake interview about what their goals are. And again, this is where the motivation comes in. They must be motivated to achieve something. My job is to help
Now,
them
this is
to
before you establish the reason they're there.
well, once they've brought the presenting complaint, once they've said what the complaint is, I want to know what they hope to achieve out of therapy. And when they tell me what they hope to achieve, I temper that goal. So I either show them that we can achieve more, or I suggest to them that that might not be possible based on what the presenting complaint is. But I have to set a realistic parameter for us to work within, because I don't want to be giving the client false expectations. So I have to say to them, well, I think we can achieve A, B, or C. It's going to take so many sessions. We need to reassess by session 4 or 6 and decide if we want to continue therapy. You may stop at any time, and I may stop at any time.